action.
Here we are going to show how to use a bag valve mask, or as commonly known as the BVM. This particular device has a one-way valve. We're going to use this to assist ventilations in a conscious patient that is not receiving adequate air, or a non-breathing unconscious patient. This device can be used for CPR and can be used for an adult or a child, as it varies in sizes. The parts of the BVM include the mask, which is placed against the patient's face to secure a seal. Next, we have the valve, which, as I said before, is a one-way valve, which keeps the air that the patient expels from going back into the patient's lungs. Next, we have the bag, which is where the oxygen is held that is expelled into the patient. Then there is the oxygen reservoir, which is normally a tube, or sometimes there is another bag attached. This collects the oxygen that then proceeds into the bag once the bag is squeezed. We then have the tubing, which this is hooked up to an oxygen tank at 15 liters per minute to administer to the patient to ensure adequate airflow. During one rescuer CPR, one rescuer ventilations, the rescuer first places the mask on the nose and rolls it onto the chin. We're going to ventilate this patient, because it's an adult, every 5 to 6 seconds, and we're going to do this by the EC grip. You're going to have your pinky, ring finger, and middle finger in a straight line, which is known as the E, and your thumb and pointer finger curled around to make a C. You push down on the mask into the patient's face in order to obtain an adequate seal, and squeeze the bag. You want to squeeze until you just see chest rise. However, if you do not see chest rise, you can push on the bag, push it down so that it helps you maintain a seal on the side of the face that you do not have your hand. You want to ventilate this patient every 5 to 6 seconds. And you want to be careful not to overinflate the patient by pushing air into the stomach. This could cause the patient to vomit by putting too much pressure on the stomach. Right here, we're opening the airway using a head tilt chin lift, which is used for a non-trauma patient. However, with a one rescuer, you only can use a head tilt chin lift. The jaw thrust is used for a trauma patient, but this cannot be maintained with a one rescuer. When a second rescuer arrives, they are going to take over squeezing the bag, while the first rescuer places both hands on the mask. This ensures a better seal and that more oxygen gets to the patient than escaping around the mask. You're going to continue to ventilate every 5 to 6 seconds. If a trauma patient is present, you would switch to the jaw thrust to avoid further damage to the cervical vertebrae. Here you do not want to tilt the neck, because it can cause further harm.
1,000.
And that is how you use the bag valve mask.
4, 1,000. 5, 1,000.